Hi, I'm Lou Ann Ennis, and I'm the supervisor for occupational medicine here at ExperTox. I'm an RN for 33 years, and I've been with ExperTox about 3 years now. Today we're going to talk about doing nail collections. We get a lot of calls from everybody, how to do it, how much, so we're going to go over all that and hopefully get everybody on board with nail collecting. The equipment you're going to need to do the test, you'll need some white paper, a good pair of sharp scissors, you'll need some clippers, alcohol, the collection envelope, and your chain of custody. And this is all the things you're going to need. These instruments all need to be cleaned just like you were doing a hair test prior to doing the nail testing. When you get somebody who comes in for nail testing, you want to first look at their nails, especially females. You want to make sure they don't have veneers or porcelain nails or overlays or anything like that. We can't test their fingernails if those are in place, and we don't remove them. You need to send them out to have them professionally removed before they come back for fingernail testing. If they have nail polish on or any kind of color on their nails, it also needs to come off. So we recommend you have some non-acetone and acetone based nail polish removers on hand. That way, if they have real nails, you can go ahead and use the acetone. With the artificial nails, you can use the non-acetone. And after they do clean their nails, you need to have them wash their hands really well with soap and water. Before you do nail testing anyway, you're going to have them wash their hands, but when they use the acetone, make sure they wash it really well, because everybody knows how bad acetone stinks and how it's just really toxic, so get all that off. If their nails are really dirty, really filthy underneath, it doesn't harm the test, it's just not pleasant to do. So don't try to clean that out or get that dirt out from under their nails. Just go ahead and clip and do the best you can. So first thing you're going to do, you got their nails clipped, got their nails cleaned, you got them all prepped, ready to go. So you can have a piece of white paper. We're going to use this to collect the nails on prior to putting it in the collection envelope. And the reason for this is that it's too hard to hit that little piece of foil with a nail clipping. It's just not going to happen. You're going to be chasing them all over the counter, and then you can't use them. Okay, so you've got your white paper in place. You're going to explain the procedure to the client. What we want to do is to clip their nails as close to the white part as you can. You don't want to go back so far you make them bleed, but you need to get as much nail as you can. We recommend letting them cut them themselves with you watching, and then you can go back and trim them for them. But less chance of injury to the patient if you don't try to do it yourself, and I'll show you how to do it in just a minute. And then with toenails especially, check with your clients, make sure they're not diabetic. Never, ever, ever cut a diabetic's toenails, no matter what the situation is. Let them do it, or you'll have to use what you can get on the fingernails. But it's very important on diabetics not to mess with their toenails. It should be professionally done by a podiatrist or a doctor. So we've got our nail paper, we've got our clippers, and Denise is going to go ahead and clean the scissors and the clippers that we're going to use with alcohol in front of the client. Just like you were doing a hair test. You want to make sure that you collect at least 40 milligrams of nail. That includes the nail itself and scrapings from the top of the nail. If you don't want to go back 6 months, you only need fingernails. If you want to go back 6 months, you need to scrape the top of the nail, and we're going to demonstrate that for you also. Okay, so I'm going to place my hand over the paper, and you're going to instruct the client to clip the nail halfway. Don't try to clip it all the way. Clip it halfway and peel. Less likely for an injury, and more likely you get a good piece of nail and it won't fly all over the room, because you can't use those. So after you've collected all the nails, we're going to pretend like we just did 10 of them. You're going to place them in the foil, and now Denise is going to do the scrapings. I can cut another one just so people can see it real good. Let's do the pinky one. Cut it halfway and then peel. That way you don't lose track of any of your nail. Okay, so we're going to go back 6 months on me, so we're going to do scrapings. You want to lay the scissors at about a 33-degree angle against the top of the nail and gently scrape forward until you see the white nail start to come up. And that's going to fall directly on our white piece of paper where we can collect it. You don't want to scrape it so hard you go down to the nail bed. But even if you take off the top layer of their nail, when they get home, if they buff it with a buffer, it'll come right back. It's not going to harm their nails. That's why the scissors need to be good and sharp, because most people's nails are pretty tough. And you can scrape one nail at a time and then go back to the other nails, and if you don't think you have enough, and do some more. That way you don't scrape too much off of one nail. And I'm trying to angle my fingers down forward so it does fall on the paper. You might want to remind people to do that. Okay, once you've collected enough scrapings and nails from their hands, you're going to take your paper, just make a little funnel out of it, and funnel the scrapings onto the foil. We didn't get very much, so you can't really see it probably on the video. But anyway, that's what you do. You put it on the foil, and you're going to wrap it up just like you do a hair specimen. You're going to fold your foil. Only thing is, with nails and scrapings, you need to really fold it because those scrapings can get loose very easily. So you're going to seal it up very well, very tight, so that nothing's going to come out. Till you make a little rectangle or a square. Everybody will have their own little method, but this is the one I like to use, and it seems like I keep my scrapings intact. Okay, you're going to have your envelope here. You're going to have it all ready to go. You're going to place it in the envelope, and then we're going to talk about sealing the envelope and using the labels in just a moment.